this off. So that way, yeah. So I would like to thank you very much, Abigail, for the opportunity for us to have this conversation. I know for many people, whether they are directly or indirectly, affected by, this topic about, mental health and mental wellness, it is a really difficult conversation. Sometimes it's people who are directly experiencing some form of, mental health issues. For others, it's that they are supporting people, whether they are friends or family or, some, direct or indirect connection. And so even just hearing, the term sometimes when people say, it's like, oh no, it triggers something in them. So I'm hopeful that in some way the conversation that we're having today will be helpful, for people in whatever phase or stage of life they're in and in whatever way they might actually need, the support. So I would like us to start with you, perhaps, giving us a little bit of a background information about yourself. I know we'll get into some more information later about your practice, but maybe just, in the next like half a minute or so, just tell us about yourself, and then we can get into more of the topic.
Okay. All right. Thank you, ma'am. My name is Abigail Olasehinde, a clinical psychologist, currently practicing for a couple of months at one of the federal neuropsychiatric hospitals in Nigeria. The passion began, um, I think 2013, when I see a lot of my colleagues coming to tell me things about themselves, deep secrets. They find that closure when they talk to me. And then I was a medical physiologist in the making. So they find closure talking to me. Hey, Abigail this, hey, Abigail that. I could remember one particular evening, a colleague reached out to me over the phone and expressed himself. And within 20 minutes, I was like, okay, how about we do it this way? How about you go about it this way? And at the end of the call, he was like, Abigail, it's more or less like you are the one that planted the problem there. Because I've been trying to get an answer to this, a solution to this, a way out of this for over a week. And within 30 minutes, like, I think the world of psychology need you more. That was a statement. And I was like, psychology, I beg, after my first degree, I'm going outside the country to become a neurophysiologist. Forget it. And then only to go back home. And my dad, during the break, I went home and my dad called me to the master bedroom and said, Tosin, I think go check up medical psychology. At the point, I was like, why psychology? Why psychology? And I read about it. I fell in love with psychology. After my first degree, I was like, I'm going to psychology. And here we are. It was actually not easy. People were like, how can you go to university like Ladoke Akintola University of Technology? As at then, the internal and external strike, a course of 5 years, I was using close to 8 years. And how can you go there when it's not as if you studied medicine and now you are going, like you want to go for another? I said, that's my passion. And honestly, it's been beautiful, it's been blissful. And when Belwet My Clinic began, yesterday was the 3rd year anniversary. When Belwet My Clinic began, it was very difficult. Because I needed to create that awareness. I was way back in NDA, Kaduna then. I remember coming up every morning with my phone, going live on Facebook, talking about mental health, bringing topics to talk about mental health. And for about a month, I was being consistent, creating the awareness. And gradually, people began to reach out. People began to reach out. I found that pleasure speaking with them, exploring through their mental, emotional life. And I think after a couple of months, and I said, okay, let me monetize it. And currently, I'm the lead therapist of Belwet Mind Clinic. We've been able to provide therapeutic services to individuals within Nigeria, Canada, the UK, the US, Morocco, Abu Dhabi, and we are still counting. And fortunately, most of those consultations, most of them come from referrals. A lot of them come from referrals.
That's beautiful. Thank you. Thank you very much for that introduction. I would like you to, segue into what you would consider if someone were to come to you and ask you, what is mental health? What would be your response to that question?
A lot of people have come to ask me that topic. Abigail, what is mental health? Abigail, what is mental health? And the funny thing about it is the first thing that comes to their mind is mental, sako madness. And I educate them, I let them know that you have your heart, right? They said yes. You have your liver, they said yes.
Yes.
You have your organs in the body, they said yes. You have your brain, yes. Okay, if your brain is not telling you to do anything, will you be able to do something? They say no. I said, just look at your brain as the seats, just like the president of a nation. Look at your brain as the seat in your mental health. So I bring it down to them and let them that your mental health comprises of your emotions, how you're able to handle your emotions, how you're able to cope with life situations, how you're able to handle stress, how you're able to handle yourself, and how you're able to fit in the environment. So that part of your health that has to do with your emotions, fitting into the environment, coping with life stressors, coping skills, adjusting to a situation, seeing yourself for who you think you are, and seeing your environment for how you think it is. That is your mental health. And then when they begin to say, okay, well, what if I'm not seeing my environment the way people see it? I said, then a lot of things can be talked about in that part. So mental health is just your emotions, psychology, your brain, everything about your body. It also includes your physical health, because let's now be sincere about it. Take a look at someone who lost a loved one. Oh, let me bring it home. A couple of months ago, my dad lost a loved one, and it was terrible. It was really, really bad. At some point, mom had to give me a call and was like, "Can you please conduct therapy on your dad?" Because every night, every day, this deep breath. Now, imagine someone who does not have knowledge on therapy, on psychology, or someone who he could share what is going through with. Before you know what is going on, it leads to insomnia. Person is unable to sleep. And before you know what is going on, heart palpitation creeping, high blood pressure creeping. Fortunately and unfortunately, if the individual is rushed to the hospital, they'll say, oh, this individual has high blood pressure. This individual has heart palpitation. But they might not be able to trace it when they did start.
They
Another
won't.
individual is placed on amlodipine, placed on modretic, placed on different kind of medication, but the foundation has not been treated.
Which that is true. So in which case then he would have benefited from grief counseling, for example, where you would have been
Exactly.
walking him through. Very
Exactly.
nice, absolutely.
Exactly.
And to kind of look a little bit more into that, there is also the element of when you talk about mental health and then when you talk about mental illness. So I want you to
Mm-hmm.
say a little bit about that. What is mental illness? Is it like a spell? Is it a cause? Would you even say it is something to hide away from? Because these are some of the words, and thoughts that people would have whenever they hear those terms, mental
Mm-hmm.
health, mental illness. They're thinking, oh no, something, oh no, I don't want to hear anything about it. So can you say a little bit more specifically about, mental illness?
All right, thank you. If we call mental health a state of well-being, a
Mm,
state of wellness. Now, mental illness is when there is a distortion in the well-being and wellness.
mm,
That is to say, not out of, not within the cultural context, not within the religious context, the individual, not within some kind of cultural belief, but the individual is having problem managing his or her mood, her thought pattern, how she sees herself, and how she sees her environment. Take, for instance, this individual believes that some people are sitting somewhere talking about her. And she says she believes so because she has some kind of supernatural powers. And these supernatural powers is not within the cultural context. It's not within the psychosocial context. It's not within virtually anything religious or virtually anything. Okay, bring a proof that they are talking about you.
Yeah.
There's no proof. Okay, someone is speaking in the radio. No, somebody has actually gone to tell him my secrets. That is why he's saying what he's saying. Okay, something happened and there's an outburst. And people are like, calm down. This is not enough to get you angry. So a little touch here, a little touch there, it's now becoming a disorder. It's no longer within the nominal line. It's now shifting from the nominal line. Now, in such a situation, the individual can be said to have, just like I'm ill, I'm having malaria, go for malaria tests. So the individual can be said to have, oh, there's an illness, there's a disorder in the thinking, in the cognition, in the thought pattern. So can be wrapped as mental illness. But that illness make people look at it that, are you trying to tell me that I'm mentally ill, I'm mentally sick? So it's just a disorder from normal. The normal way, the standard, according to the individual's cultural belief and all. So a disorder from it.
Okay, thank you. Now, a lot of people have this mindset that mental health therapists and clinical psychologists are doctors for mad people. And I really emphasize that word mad people, especially in the, cultural context of, say, a place like, Nigeria, where, we have, again, talking about this, myths and, these distortions and assumptions about mental wellness, if I would use that. As a professional, what do you have to say about this assumption? And, to actually go a little bit further, even these assumptions and these beliefs are not necessarily unique to a place like Nigeria, for instance. I'm just using the Nigeria context because I know, some of, the people, joining our conversation are, mainly, joining from Nigeria. But I've had experiences with people from other parts of the world where, they mythologize, this, terms of mental health, mental illness, mental wellness. It's like anything, once you put the word mental in it, it's like, oh, this way. No, I don't want to hear that. I don't want to know about it. So what do you have to say about this assumption around, oh, they are doctors for mad people? What would you say to that as a professional?
Honestly speaking, just as you've said, this misconception is not tied only to Nigeria, but I would say, if we want to conduct a statistic, I think Nigeria will still have the higher value. So when it
And you
comes to
practice
doctors,
in that environment as well, right? So you have a lot of
yeah,
experience with, people in that cultural context. Thank you.
you're right. Thank you. The way you hear people, doctor for mad people, I think it's a misconception, it's a myth that is now becoming a language to the lip of a lot of people. When you say, oh, I could remember I think 2 years ago, I referred someone to a pastor, and while I was introducing myself, I say, oh, I'm a mental health therapist. He didn't know the meaning of the therapist. All he heard was the mental health. He knows Yaba left. And then the next thing he said, no, this is a church. They used to bring mad people to the church. Honestly speaking, I was thrown off balance. I was like, in this 21st century, a pastor saying this, and then I have to introduce myself as a clinical psychologist. explain what we do, and he was able to resonate with it. So what I would say is, in a country like Nigeria, though the awareness is way better compared to a decade ago. A decade ago, I knew little or nothing about the duty of a psychologist. All I thought is they go to school, primary school, they teach education. So I believe that as time goes on, there also, the more the awareness, the more the misconception will be cleared. Now, clinical psychologists, mental health therapists are not doctors for the mad people. Instead, who are they? They are doctors, or they are professionals, they are practitioners that help individuals see the reason why they think the way they think, and how it can be adjusted. Because if we look at everything about most of the disorder, is it the anxiety disorder? Is it the depression? Is it the mood disorder? Is it the psychotic disorder? Is it the personality trait? They stem out from our cognition, how we think. So a distorted thinking pattern will definitely lead to a distorted reaction, a distorted outburst. So the duty of a clinical psychologist is to help interview that individual. Why are you having these distortions? Assess that individual. Let's probe into the foundation. Let's probe into when it started. And then work with the individual. Now, there's a misconception that clinical psychologists help to change someone's thinking pattern, more or less like you're going to the military academy and they brainwash you and they put what they want into you. No, we don't force anybody to do anything. All we try to say is, someone come and say, oh, I cannot sleep at night. Okay, for how long has it been going? Oh, it's been going on now for about 3 weeks. Okay, 3 weeks. Before 3 weeks, were you sleeping well? Yes, I was sleeping well. Okay, can we cast our mind? What happened 3 weeks ago? And the individual says, 3 weeks ago, I cannot remember. Okay, can we just be calm? Can you open your eye and take a look at this office? How does it look like? Okay, close your eye and tell me how the office look like. I'm trying to bring the individual's distorted mind and distractions to my spot.
The present.
Okay, now let's travel 3 weeks ago. What happened? What happened wasn't a big deal. It's something that has always been happening. Okay, can we talk about it? And in the process of talking about it, and then they said, okay, what if this is actually what it has done? And they say, yes, it's true. It's not just the sleeping part. And then it's more or less like you are bringing the cause of the problem, quote and unquote, to their presence. And the next question they ask is, so what can I do? So now, a mad person cannot relate. A mad person is out of reality, is completely psychotic. And moreover, they call it mad people outside there. In the clinical setting, we don't refer to them as mad people because it's a stigma. It's unprofessional. So rather, if we say that these individuals have lost touch with reality, we will say they are psychotic. The losing touch with reality, it could be hallucination, it could be delusion, it could be any of it. So we'll say this individual is psychotic. So the goal now will be to bring them from the psychotic realm into the realm where they can communicate with us, and then we'll be able to proceed. So in the world of clinical psychology, there's nothing like mad people. Instead, we are doctors to everybody.
Help and support. Thank you. And just, building on that, can you, say a little bit more about those myths and stigma? Like, tell us some of the either, the common ones or the ones that you've come to know in the course of your practice, or even some that you might have had people throwing around, whether it's, when you're using social media or even when you're interacting with people, in person. Like what has, and also maybe talk a little bit about some of the common reasons for these myths and stigma.
All right, thank you. You hear people, the first are the very common. Men don't cry. It has done a lot of harm than good.
That's a big
And
one.
if very big one.
Yes.
And if we look at it very well, I would say where it started from, the traditional part, the cultural part, it started from. They wanted to build strong men.
Mm.
You hear the Yoruba saying, "Akọni ọkùnrin, ọkùnrin méje àtàbọ̀." It's they're like eulogizing the man,
Yes.
making the man see himself as a demigod.
Mm.
You are the head of the family. If your wife is crying and you are crying, the children are crying.
And you.
What type of family is that? And now they successfully build a man who at the facade does not cry, but bleeding
Yes.
internally,
Mm.
looking for who to talk to, looking for a closet to go in and cry. But that is not enough. So men are just like women. Biologically, aside the hormones, aside the sexual organs, the heart for a man is the heart for a woman, the brain, the like it's not as if a man has three cerebral cortex, the left and the right hemisphere. It's not as if a man has three hemispheres and then the woman has two or one and a half. No. So why are we now subjecting this men under an emotional torture of not being able to express themselves? I've had this a several number with male therapy session, and in one of those sessions the man said, "Have you seen a man cry before?" Like it was bottling it. And I was like, you can cry, right? I'm a
Mm.
clinical psychologist. I'm not I'm not your judge. So you can cry. And the last time I checked, a couple of days ago, one of the male clients cried. That was enough. One of the male clients cried. Oh, I wouldn't be the first to cry. And oh my God, all heaven was let loose. Cried and cried and cried and cried. And I gave him all the time to cry. Now, they've bottled themselves for too long. It's more or less like um a pipe which has been extended. More water, keep extending. Or a rubber band. The more you keep stretching a rubber band, it's stretching, it's getting thin, going through the pain. At some point, it just break. So to some men, they might be unlucky. Their breaking point might be an heart attack, might come up with a stroke, might come up with an high blood pressure. And to others, their breaking point might land them in an hospital where there are clinical psychologists. Another myth is mental health is the sign of weakness. Mental
Mm.
illness is the sign of weakness. Ah, no, 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 no. And that's where you will see a judge coming up. I put them as judge. Apologies to all the barristers who will be watching this. But let me just put them as a judge
Mm.
coming up and say, madam, is it because of one child that died? That is why you think the world has come to an end? And then she goes on to say, she has lost 7 children out of the 14 children she gave birth to. Jesus give, God take. If you kill yourself, who will take care of these children? Brace up, be a woman, brace up for your children, brace up. No, no, no. When it comes to mental illness, when it comes to a hit to the brain, a hit to the heart, there is nothing like brace up. The way I treat my malaria is different from the way someone else treats her malaria. I've met a colleague who said, I don't treat malaria more than twice in a year.
Mm-hmm.
The first 6 months, the second 6 months, no matter how the malaria does, all I take is vitamin C 1000 milligram. I tried it did not work. I had to tell myself, I had to tell myself, Abigail, go to a pharmacy and get medication. So the
Mm-hmm.
way we adjust to life stressor to what life throws at us is different. For the fact that someone is unable to adjust, let the person grieve in the pain. It's not a sign of weakness. And to others, they say, snap out of it. Pretend like nothing is happening. Faith, and honestly speaking, the message on faith when it comes to mental health is a problem. We need to know how to cut the dichotomy so as not to endanger the health of people. There's nothing like snapping out. I cannot snap out of malaria. I cannot snap out of typhoid fever. There is nothing like snapping out of stroke. There's nothing like snapping out of any diabetes. Somebody cannot snap out of diabetes. So what makes people think that the seat that controls every of those things, you can snap out of it? Are you trying to play upon my intelligence? The brain will be like, wait, do you take me for a fool? I actually try to play upon my intelligence. Do you think I don't know what's wrong with me? You're telling me to snap out of it? Attend to my needs. Give me what I want. I'm hungry. I need this. I'm lacking dopamine. My serotonin is crazy. Adjust it. Give me what I need. Stop telling me to snap out of it. And to others, they will say, they say, I'll say it in Yoruba and I will transcribe. Oh, she want konra by. Madalo konra, got on shelo jekoma konra. Why are you being aggressive? And someone will say, don't talk, don't talk. He's not well upstairs. What is happening that's making him or her to be violent? No, no, no. Anybody can be violent. Anybody can be aggressive. It's a trait. It can be in anyone. For the fact that someone is aggressive should not be a label that something is wrong with the individual upstairs. Instead, it should be, what is making you aggressive? Do you want to talk about it? So there are a lot of myths. And yeah, a man should not talk, a man should not cry. A woman can come and see a psychologist, but a man, why will you come and see a psychologist? I had this a session. I was having a session with a student. I was invited by one of the universities to come and give a talk. I gave a talk on anxiety disorder and mentor-mentee relationship. So I gave out my contact, and over the course of the month, the student reached out to me, and she actually had a health challenge in which people are not understanding her the way she thinks they should understand her. They are trying to create a limit for her. Oh, someone with this health challenge cannot do this. You need to adjust your dream. You need to adjust your goals so you're not going to die before your time. And it's making her look like, wait, I'm not the cause of this health challenge. It's my parent that is the cause of this health challenge. More or less, if they didn't give birth to me, I would not be an SS. So why are they making life difficult for me? Why are they making it look like I not achieve my dreams and my goals? So definitely it's telling on her, okay, maybe I should just die. I should just go instead of me trying to achieve my dream and everything goes haywire. And in the course of the discussion, she began to speak and speak, burst into tears. I never knew that she went to hide in a closet speaking to me. And the process of speaking, I heard the mom's voice. I was screaming at her, what's happening to you? Why are you crying? She quickly ended the call. And then the mom called back and was like, I'm grateful that the mom is a nurse. So I was expecting that she should understand me better, but I was wrong.
No.
I was actually wrong and I was disappointed. And then she was like, how can she? Why would she be crying? Speaking to a stranger. What does that stranger have over she, the mother? And I had to introduce myself. Ma'am, I'm not a stranger. I'm an alumni of that university. I was invited by a professor to come give a speech in that university. I'm not a stranger. I met your daughter one-on-one. We discussed before the conversation came here. I'm a clinical psychologist. I'm not a stranger just from anywhere. My first degree is medical physiology, and then she calmed down. So I see some people, they have this form of ego, which they are not ready to let down for healing. And then I was thinking I've actually mounted that battle only for the father to get involved And the father said, even though, and even though I knew that, yes, even though something is wrong with her and she's not a stranger, even though, what is it she wants to say that she cannot say to we, the members of the family? And she's taking it out there. It's just like me going through something and I'm taking it out there. It can never happen. Right there, I knew that no, this person is actually from a lineage where the myth is very strong.
Yeah.
So I believe with continual awareness, things
Mhm.
will continue to get better.
Thank you so
To
much.
continue to get better.
Exactly. I'm glad you brought that, repeating that. This is what we're trying to do, with this conversation, right? Is to create awareness, is to hopefully, share information, share some knowledge, share experiences, some of which, you've been using as examples, to help ourselves, to help our communities, to help our connections, our networks, to see that, um, first of all, we don't have to stigmatize, you know,
Mm-hmm.
mental health, mental wellness, mental, illness, if you will. And second of all, when we do, come up, when we do experience these challenges, that it is okay, to seek help. Again, I mentioned earlier about the fact that, this conversation is, sometimes, difficult, especially for people that are going through tough times, or, they may find that they are reluctant, to speak up. From your practice, I'm pretty sure you're also aware that there are some people that would have had, some unpleasant experiences, with, mental health professionals like psychologists, psychiatrists, psychotherapists, counselors, even social workers and others. How can you, again, as somebody who is very much, invested in this, practice, how can you reassure, such people that it is worthwhile to still go and seek, mental health support services, despite whatever negative, experiences they might have had, or they might have had someone say to them that they had a negative experience.
All right, thank you. I will start from the teenagers to the adults.
Mm,
I'm also a lover of kids and teenagers, and I go often for the social education in which I go to schools. Let's give a mental health awareness. Um, let them see, bringing the big picture to the present. And a lot of students will come and say, they will just come and sit before me and they'll be looking and they'll say, I don't know where to start from. And I'll say, you can start from anywhere. You
mm,
have my full attention. You see that statement, you have my full attention. They go all the way. They go all the way to speak. And they are speaking, I'm giving that nodding. I'm letting them know that I'm immersing myself in what you've been going through.
mm,
And then when they are through speaking, I say, while you were speaking, I try to put myself in your shoe. And I was going through every word you were saying. And despite not being the one who went through that pain, I could feel the pain in me. It makes them feel comfortable that they are speaking with someone who can resonate with what they are saying. And a lot of people, their healing begins there. Now, to those who have had a bad experience, they have they have the second thought. Imagine they visited a psychologist who has gray hair, who is elderly, and they were not satisfied. And now they come to a young lady who is all smiles, in which they can't even tell her age because her smiles has covered her eyes, has covered her face.
mm,
And they're like, wait. And, and you see them they're being skeptical.
mm,
And I'll be like, something is bothering your mind. Do you wish to share? And they say, I've visited countless psychologists, I've visited doctors, I've visited this, I've visited that. Nothing. I am actually visiting you because you were recommended. You came highly recommended. So and then you see them, they're already expressing their pain because you came highly recommended. I don't know. I don't know if you'll be anything different from those I've seen. I don't know. Okay. And they're fidgeting there. I'm like, okay. So do you mind us talking about this?
Mm.
And they're like, okay, you want us to talk about it? Okay. And then they try going through the fast lane. And I say, okay, please, you said this happened so and so, and they say yes. Now they feel this relief. Oh, this person is listening to me.
Mm-hmm.
I think one of the skill, one of the variety, one of the ingredients that people are looking for is someone who will listen.
Yes.
And then they say, oh, this person is listening to me. And before they proceed, they try to cut you. So what will you say about it? Am I the one at fault? They
Mm.
want to see if you will judge them before they say their deepest secret. And you say, no, I'm not a judge. I'm a clinical psychologist. My goal is to make you feel better. Okay, now with what you've said, do you think you are at fault? They say, maybe it was actually the way the individual acted. I was angry. No, I'm a woman. I say, yes, sure, we are woman. Like the Newton third law of motion, to every action, there's a reaction. This is someone who is intelligent, who is connecting the dots with external factors of life, and then they are able to express themselves. I've met an individual in which, and being operating on the virtual path,
Mm.
there are still some people out there who believe that it has to be physical. I need to, and I'm like, okay, I'm going to give you a one-off free session. If
Mm.
I'm unable to bring you to my spot, please, you can go elsewhere. And
Mm-hmm.
after the one-off session, I say, okay, um, before we round off the session, they said, no, are we running off the session now? Can we extend it? This, that.
Mm-hmm.
Now to
See,
others
they
who have
see
had them,
value in it. Mm-hmm.
exactly. Now to others who have had terrible experiences, like way terrible experiences. I could remember back then when I was in Kaduna, um, I was actually reading one of the abnormal psychology textbook, and while reading, permits me, but I would say one thing that has made Abigail to be who she is today is the help of the Holy Spirit.
Mm-hmm.
I
Mm-hmm.
say it everywhere, the help of the Holy
Yes.
Spirit.
Mm.
I was reading through, and then the Holy Spirit was like, take your pen and start writing.
Mm.
I was writing out questions, writing out questions. And he said, keep them there. I never knew that a client would be referred to me the next day. The next day, I got a pop-up. A client I came highly recommended.
Mm.
And the client was like, you came highly recommended, please. I need session for XYZ, XYZ. I said, okay. And right there, I was at the leadership meeting. The Holy Spirit said, start typing out these questions into a Google form. You'll be sharing the link with this individual. I did that, shared the link with the individual that night, gave a call, just a prepping. And then the next day, the individual replied the questions. I gave my feedback, and this is a statement the individual said. The individual said, I've been having depression for over a decade now. I've wrote out several ways to die without pain. I've met a lot of people. I've met doctors. I've met psychiatrists. I've met psychologists. But I would do better if I'm on their seats and they are my patients. But with what we've had within this short period, I think, I think I can, I think I'm safe in your hand. But can I trust you? Then you
Mm.
say that, oh, there must be have been an issue of trust somewhere.
Fast. Mm-hmm.
And I said, I don't force trust. I earn it. During the course of the session, If you think I've earned your trust, fine. If you think I'm unable to earn your trust, kindly let me know. The second, third session, the individual was like, you have all of my trust. So I tell people, for the fact that you have a crate of egg, you've broken the first 10. They are all bad. It doesn't mean you should take the remaining 20 and throw them away. You will keep breaking. Even in fact, the 29th, you will still be hopeful that the 30th will be good. It's just like the mother hen who is about to hatch the eggs. She hatched the first one, the second is bad, the third is bad. She will keep hatching to the last, hoping that it will be good. So just the same way we have some nurses who injected me in the wrong way, and it resulted to a keloid, doesn't mean I wouldn't go to an hospital again. Just because a pharmacist mistakenly prescribe, which shouldn't be, but nobody's above a mistake. Mistakenly, due to the troubles of this world that was disturbing him or her, mistakenly prescribed the wrong, administered the wrong medication, isn't a yardstick for me not to visit the hospital again. For the fact that a doctor mistakenly prescribed a wrong medication, a wrong dosage, for I'm alive, right? I didn't die in the process. It doesn't mean I shouldn't go to an hospital again. We have had a lot of people with nasty experiences with lab scientists. That didn't stop them from visiting another hospital to run another blood test. So why should it now be that for therapists, mental health therapists and psychologists, I've visited one, I've visited two, I'm not visiting again? Actually, the person who will suffer the brunt is the individual in question, and not the professional who might have made a mistake.
Made a mistake, yes. Let's talk a little bit about financial aspect of seeking help, because we're still on the subject of like trying to seek help, even though people might have experienced, they might have had unpleasant experiences in the course of doing that. We know that accessing quality therapy is quite expensive. Some people cannot afford, whether it is a talk therapy, the counseling, psychotherapy, but even for some who may have recommendation of medication as well, for their mental health challenges. We know that this can be we know that cost can be a barrier. So what would be your recommendation in that regard for people who may be finding it a little bit difficult whether to afford the medication or the talk therapy?
All right, thank you. Before I proceed into that part, I remembered something, the part of the myth about mental health. To be able to make individual feel safe and secure. As clinical psychologists, we don't refer to them as patients. We refer to them as clients. So that anything they are bringing from outside, it wouldn't be amplified. They said I'm their patient. So truly, I'm sick. But we refer to them as clients. Now, coming to the financial part, the truth about it is, even if clinical psychologists today choose to say that service fee is 1 naira, some people will still not pay. They will still not pay. They will still say, why is it not free? And these same people, when you say, okay, it's free, they will say, it's free. Then it simply means you are doing nothing for me. So I think no value in it, exactly. So I think the bone of contention is, the more the awareness, the more people will see the reason why they should take care of their mental health. Quite all right, it's expensive. Yes, I could choose to go to a doctor. I say, I've not been sleeping well. I'm having headache. This. And doctor said, okay, I'm going to give you amitriptyline and Valium. I go to the pharmacist. They say, oh, the total of everything is 1,500 naira. I begin to use it. I'm sleeping. After 2 weeks, I say, I've been using this thing continuously. Let me stop using it. And then it comes with its reaction. And I'm like, oh my God, I'm a mother of 4 kids. My husband, oh, this, I'm too young to die. Will I be on medication for life? Hold this, hold that. And someone says, why didn't you see a psychologist first? Okay, let me go see a psychologist. And they come to you and they tell you all the problem of their life. They express themselves to you, how they've not been able to sleep for weeks and months, and they went to the hospital, they were prescribed amitriptyline and Valium, how they started using it and they've been sleeping, but they said they should stop it, and they're beginning to see reactions, heart palpitation and all. They went back to the hospital. The doctor said, you are not to stop it. You should continue to use it. My doctor. At that moment, you are their doctor. my doctor, what can I do? What should I do? And then you say, okay, I'm going to assess you. We'll have a clinical interview and then assessment. We'll see actually what caused it and how we can help manage the situation. Okay, I'm ready. And then you say, oh, the consultation fee is 20,000 naira. And you say we are operating on a 50% discount. That is why it is 20,000 naira. And they say, what? 20,000 naira? Madam, even that medication where I buy, now 800 naira finish am. 20,000 naira. Now they see that you actually have the key they need. They won't be able to speak down, but they will say, okay, give me time to think about it. They are not coming back. Unfortunately, after 2 years, you get another recommendation. They are still the same person. Things have decapitated so bad, and they begin to come up with I wish. Now I tell people, the bitter and the honest truth, the sad reality is this. If you go to an hospital, the doctor says an emergency, we need to conduct a surgery, we need to do this. Every family member goes out to get how they can sort out the bill. I said that is the same way it should be when it comes to mental health. Don't look at clinical psychologists as they are just talking to me. Someone outrightly told me, is it just to talk to you? I'll pay money just to talk to you? Like for you to just talk to me. That part of me wanted to tell the individual, why not just go stand in front of the mirror, talk to the mirror and see, and let's see if you get better. But I just smiled. So I think the awareness is not yet enough. If the awareness is enough, I think things will get better. Secondly, we cannot negate the fact that the economy of the nation is not smiling on a lot of people. So they actually want to. Imagine someone whose total earning in a month, in 30 days, is 50,000 naira.
Yes.
And now the individual knows that there's problem. I need help. Things are getting worse day in, day out. And I let people know that your mental health challenge is like a tooth decay. The more you procrastinate, the more you give excuse, the more it gets worse. And the moment when you think, okay, I need to go see a practitioner now, if what should have been done should have been different therapeutic techniques, it has now gotten worse. It's now a psychotic disorder. Medication needs to come in first. So treat the mental health like you are having a tooth decay, a sore, a decay in the tooth. Now I'm bringing it now to the economy of the nation. Someone who is earning 50,000 naira, and an individual comes to you and you say, oh, 50% discount, assessment, consultation fee, instead of you paying 40,000 naira, you're going to pay 20,000 naira. And the individual says, madam, the only thing I can afford now is 5,000 naira. And you say, okay, can you make it 10? And the individual goes all out and say, what I'm earning is 50,000 naira. In fact, that 50,000 naira, what I get after different things have been removed is 20,000 naira. How I'm being sustained is the grace of God. But the honest truth about it is the grace of God is sustaining them. But the grace of God will not take care of my bills. The grace of God will not take care of the training I need to keep enrolling in to become a better person, a better practitioner. The grace of God will not take care of other things that I need to do for my practice to keep booming. So if I want to say, okay, let me show mercy, how many people would I show mercy to? But when every individual comes to the mindset that I'm going to see a practitioner, a professional, and it's an emergency, and they see a clinical psychologist the same way they will see a doctor, they see a clinical psychologist the same way they will see an hospital, I believe things will get better. Because honestly speaking, an individual who is mentally and psychologically, emotionally fine would be able to do things better compared they are doing now. Maybe that individual is working a job of 50,000 naira till date because um job owners cannot give the individual job because they stylishly gave the individual a test, and they saw that, oh, this individual is having depression, is giving out anxiety disorder. Oh, though the individual is good at what we want, but with this we cannot manage this. Oh, this individual is giving bipolar, and then it has made the individual lose opportunities of 500,000 naira, 200,000 naira job offer. So when we come to that reality of I'm going to see a doctor for my mental health, for my brain, for my well-being, I think it would be better. No, they wouldn't see it as being expensive. Myomectomy, you see a lot of people living in a particular state, going to another state for myomectomy because they said that doctor is good and has a high success rate. Though the state they are in, myomectomy can be performed for 500,000 naira, but where they are going to is 1.5. They don't mind. Please borrow me money, loan me money, do this. They sort that out because they know that when they are fine, they'll be able to do things they're unable to do now. When we bring that mentality into the mental health, into this profession, I think it will get better.
Will get better. I agree. I agree with you definitely. Now, on that note, I know Belwet Mind Clinic, you do have congratulations on the third year anniversary of your practice.
Thank you.
And I know you have a lot of services, in your practice. Perhaps you can tell us a little bit about, some of those services, while also maybe I also know that you do have some special offers to celebrate this third year anniversary. So perhaps that would be a nice way to, talk about that in the context of, what we were just discussing in terms of, the financial challenges that people face when they try to access, mental health services. So can you maybe link that to your practice, which very successful, I would say, and now it's in its third year, which is beautiful.
Thank you so much about that. Now, Belwet Mind Clinic, let me come from the part of where the name came from. The name, I was like, I need something that can resonate with people, resonate with me. And I kept writing acronym, doing everything together. It wasn't working out. And then I came up, oh, better life and wellness. Better life and wellness therapy. I said, oh my God, I gave it to my web developer as at then. The name was just too long. But I quickly went to buy that name. I purchased the name. Let me secure the name. But better life and wellness therapy. I said, just hang in there for a while. And after a couple of months, I don't know, I just got this inspiration. Well, wait, better life and wellness therapy. And then I quickly again went to secure the name before that, and then the website was developed. Now, the goal of Belwet is to give our clients, to give people who consult our service a better life, to give them wellness, the better life and the wellness through therapy. Now, what are some of our services? The first on the list, when people come and express themselves and everything, I tell them, you need to be assessed. Assessment first, because that's what I can always hold on to. I say, this is why it is this. And they say, okay, can't we just jump that step? I say, if we jump that step, do you want me to do you counseling? And I come with an example of a tree. A tree is growing in a place is not wanted. And I keep cutting the shrubs, trimming the leaves. That's not the solution. The solution is to excavate it, to uproot it. So that assessment to take me to the root so that we can work together in uprooting it from where it is, which is an unwanted place. And then we actually have the clarity call. We have a website. I'm scrolling through to say through it. The clarity call. You see a lot of people, they come in and they say, okay, I'm confused. I don't know what to do. They give you a lot of options they have upstairs. And honestly speaking, I've been in that place before, in which being a lady with a lot of caps, a lady with big dreams. Honestly speaking, having big dream comes with its own pain. I saw myself being good at doing everything, but I had to tell myself, streamline it. Because you cannot be good at doing 10 things and expect at once and expect any of those things to grow, to rise. So some people come with that desire. We offer the clarity call, depending on the clarity call cut across their better life and wellness. And then we have the next one, which is the trauma-focused therapy, the grief therapy. A lot of people be like, oh, they've lost someone, then this and that. We help to work them through. And the beautiful thing about it is I am someone that loves to learn. Keep learning, keep exploring. It's a beautiful thing that I've been a 3-time trainee with Cleveland Clinic, and my trainer is Thomas Zimmerman. And he's a PsyD with over 39 years clinical experience and has taught over 17,000 clinicians. And in most of the training, I'm the only Nigerian and the only African. I'm the only Nigerian, the only African. So they say, oh, well, Abigail is fine. Abigail is fine. You don't need to pronounce the name. We can maintain the Abigail. And that's where I got exposed, and I was able to explore the EMDR therapy, eye movement sensitization, movements. So explore through it. And honestly speaking, it has been really helpful. I've explored it with a lot of my clients, and it has come with solid feedback. In fact, there was a client that reached out to me. I was on transit, and the client was like, I stumbled on YouTube. I was watching a clip, and then the client was someone that's learned, love to explore. And then while watching the clip, they talked about EMDR therapy, and I said, no, this is exactly what I need. And this is an individual who has visited a psychologist in the States, in which the psychologist said, nothing is wrong with you. Go back home. And this individual knows that I need this. And then the individual said, I went online, went to Google, and I just typed EMDR therapist in Abuja. And Belwet Mind Clinic popped up, among others. I saw others, but my mind connected more with Belwet Mind Clinic. And I'm reaching out. And honestly, the feedback that came out of it was excellent. So we offer the trauma-focused therapy. We've offered the trauma-focused therapy to clients within Nigeria and the USA. That's where we have our record of trauma-focused therapy at the moment. And also the psychological disorders, ranging the anxiety disorder, the mood disorder, behavioral and emotional disorder, eating disorder, obsessive compulsive disorder, sleeping disorder, and PTSD, the dissociation and dissociative disorder. I actually watched an American movie. The title I'm bad at remembering. And honestly speaking, I saw a practical display of DID. And this young man in a correctional center, or a rehabilitation center, when they come in, the attendant comes in and say, "Hey, Josh, no, my name is not Josh. My name is Michael. Never you address me as Josh again." And then the family members come and they say, "Hi, Josh." They say, "No, my name is not Josh. My name is Brian." Comes with strong evidence. So I remember I made a post on DID in a group on Facebook, a page on Facebook, and a white lady reached out to me. But unfortunately, the DID is not something that we can do virtually. So I had to say, please go to the center in your state.
Exactly.
So yeah, go to the center in your state. And if we should bring it to the religious part, I sat and I was asking myself, God forgive me. But I was saying, if scientists and practitioners want to put in the 100% practicing sense, professional sense into DID, and they want to remove the God factor, that's where they would say the man with legion, that it is DID, that it might not be his possessed. But honestly speaking, I let people know that the spiritual controls the physical. So we cannot rule out that part of the spiritual in everything we do. And addiction therapy. A lot of people are addicted to different things. A lot of people are addicted to substance. They are addicted to gambling. I've had a client who was so addicted to gambling and was at the verge of committing suicide. But all thanks to God, the client is doing better now. And the client said, "Auntie Abigail, I'm going to go out there. I'm going to achieve my goals. I'm going to stand before the people. And when I'm being celebrated, I will say, Auntie Abigail made it happen." I was like, oh, wow. So addiction is a very strong thing. Unfortunately, addiction to substance is on the rise among youth. It's at an alarming rate. You hear some people saying, I've been smoking, I've been drinking for 10, 15 years. Nothing is wrong with me. I'm still fine. But what they don't know is they don't know the next drag of substance. They don't know the next sip of alcohol they will take that will make them go psychotic. They never can tell. Maybe it's the next 10 drug that will make them lose touch with reality. But unfortunately, despite the alarming rate in the psychiatric ward, where bed is being filled up and patients, now they are patients, they are no longer claims, psychotic disorder, where patients are waiting for bed space. Despite that, the friend of that individual who has been brought in is still smoking. He's still drinking, thinking that he or she has a superpower. But honestly speaking, this time around, it has gone beyond a misuse and abuse. It is now an addiction. They cannot do without it. Their life is in it. Their source of joy is in it. Their excitement and dopamine comes from it. And that's where a rehab is needed, to be rehabilitated, to go through data, to go through the drug rehabilitation educational school. And then we offer the child and adolescent therapy. And someone is saying, is it only you that offers that does all of this? Oh no, no. Oh no. In the clinic, when people reach out to the clinic and they bring out their complaint, we have volunteers in the clinic. We have people in the clinic in which out, like we have the in-house, we have the out therapist, in which we can reach out to them. Okay, this patient is going through. Some people will come and say they want a male therapist. Oh, fine. Reach out to the male colleague or something like this is going. Please handle it. We'll sort out the bills together later. Child and adolescent therapy. A lot of people think that children don't go through anxiety. They think children are not depressed. They are. It's just that they might not know how to express themselves. They might not know how to say it. But when you see a child who is depressed, as a professional, you can cite it. You can know. Now, child and adolescent therapy, anger management. You see a lot of people reach out and say, aside the anger, my wife is an angel. But when the anger comes like this, she can break anything. Aside the anger, my husband is an angel. I was at the data unit, and I was giving a talk and education on anger management, and I made them understand that anger is like a Rottweiler, that breed Rottweiler. When the owner comes at night, is unable to recognize the owner, and out of the spur of the moment, the surge of the moment, he kills the owner. Killing the owner, reality dawns. I just killed my owner. I thought he's an intruder. I said the same way with anger. It comes at the spur of the moment. You take action, and after the deed has been done, you're like, well, I shouldn't have. There's still a bit of conscience, but it gets to a level in which you say, he shouldn't have provoked me. I was provoked. So anger management, how to walk through managing anger. Family and group therapy. We have our family therapist, the family and group therapy. Okay, this is what is going on. This is how okay, how it can be handled and all of that, which is also the couples and relationship therapy. And also we have a nurse, in which that's therapy for diabetic and hypertensive patients. Because honestly speaking, these people also need therapy. So when they reach out, okay, we refer them rather to the nurse, the practitioner. Okay, this is it, and it's taken up from there. As that individual is giving out what should be done, the diabetic education, the place of therapy, the therapist coming, like we are just trying to ensure that there is an holistic healing from the every part, every angle. And honestly speaking, Belwet clinic is still small, because the goal is, by God's grace, to have a physical office, a clinic, and make it that people can walk in the same way you walk into an hospital. You can comfortably walk into Belwet clinic, walk out without thinking that that person looking at you is like, this person just went in. So we are still in the awareness creation phase. That is what I would say, still in the awareness creation phase. And we also have the mentorship part, what we mentor people through life journey and through life process, and also the NLP, neuro linguistic programming, efficient for kids and adults, how they are able to manage their emotion, get to dig into their skill, get to dig into who they are, how they can amplify, work on their strengths. It's just like someone who is using the left hand, and everybody is out there yelling, no, use a right hand, forcing the individual to use a right hand. So we help such an individual. You can build on your strengths, maximize it. You get to know, oh, this is actually why I do what I do. Okay, this is how I can improve. Oh, these are the things I'm doing that's making people think that I'm on the wrong track. I can actually adjust. And then the executive part. Okay, in Belwet clinic, can we invite you and your team to come to our office to give us a talk on how to manage stress and family, how to cope with life stressors, all of that. Yeah. Belwet clinic is a very broad umbrella.
Thank you. Thank you so much. What a beautiful note to end our talk today. Thank you very
Thank you.
much, Abigail, for your time and for sharing all of this really valuable information with us about how to take care of our health, to take care of our mental health specifically, and mental wellness and mental well-being. And I also like the fact that you talked quite a lot about the misconceptions around mental illness, because I think very much, very strongly, and I agree with you that there is still a lot of awareness that we need to create. There is still so much more room for a lot of work to be done, whether that is among, young people, whether it is, older people, whether, it's among our family members, our friends, our colleagues, to kind of, carry that banner and, raise that flag to say, our mind, this is like the engine of our entire being. And
Exactly.
if your mind is not, fully tuned, if you will, then there's likely to be some hiccups here and there, whether it's in behavior or it's in your output and your performance and your perception. And so I am really grateful that you created the time and the opportunity for us to have this conversation. And as I was listening to you list, the number of areas of practice that our Belwet Mind Clinic has, I'm hoping and looking forward that we'll be able to have additional sessions of this conversation where we actually dig deeper into specific areas of psychology. For example, it might be that we talk about trauma, for instance, the fact
Mm,
that people might carry trauma through, like young phases of life into adulthood and what that does, to the body, what it does to the mind, what it does to the way that they show up day to day, in life. You were talking also, for example, about, diabetes, therapy. That is, something that potentially people might have never thought about as, oh,
mm,
there's a mental element to that. They think of diabetes and they think, oh, sugar, I don't eat too much sugar, and, it might
mhm,
affect your kidney. But the mental aspect of it, how that is connected. And potentially, there might be people, in our conversation right now who may either have, older family members that are, living with diabetes, or they might have just been diagnosed with it as well. So to be able to have that conversation, whether it's for like 10, 15, 20, 30 minutes where we focus specifically on that, and they are able to get additional information from it. And of course, before we go, I usually like to give this very important information, which I'm sure you can, add to, which is, whatever information that we have shared, in our conversation today is not a medical advice. It is not a
mhm.
replacement for
Yeah.
consulting your own, individual medical, professional, whether that is your doctor or your nurse or your therapist, so that you don't take whatever information that we've shared as your, a form of counsel to say, oh,
Mhm,
Jumoke, I had Abigail say this, in their conversation, so I'm gonna do it, and if I don't get the result, then it's their fault. No, it's not.
mm,
Just trying to raise awareness. We're sharing information, sharing knowledge, sharing experiences, with the hope that it will stir in people the desire to go out and seek support when they need it. And if you're already seeking support, for you to know that it is the right thing to do and that you should continue to do it. And of course, if you need professional advice, by all means, you can reach out, to Abigail, who is a professional who is running a clinic and will be able to, provide professional advice and professional support once, there is a client and psychologist relationship developed. On the last note, before I let you go, what additional information would you like to share with us, Abigail?
all right, thank you. The first part is whenever I'm invited to speak, I let people know that any claims, any referral, any recommendation that will be coming from that point of view,
Mm,
the individual is privileged to enjoy a 50% discount. So to all those who will be watching and listening and they would love to speak to a therapist, consult Belwet Mind Clinic, they are open to enjoy the 50% discount. And the few thing I would let someone know is that what you are going through shouldn't define you. Your experience shouldn't define who you are. Secondly, you might not be able to change the past. The past has gone. You definitely cannot change it. So don't stress all you have. Don't stress your brain and your mind trying to change the past. Instead, give all you can to create a beautiful today and a wonderful tomorrow. And that's where you hear a lot of people say, we are not what we've been through.
Mhm. Mhm.
That is because they refuse to sleep in the past. Because the bitter truth about it is the more you dwell in the past, the more you dwell where life has placed you, the more regret it brings, the more stress it brings, the more you begin to, the more depressed you get. And it gets to a stage in which things go off. And also, I want you to know that this a tough time never lasts. It's just a phase. Whatsoever you might be going through as you're listening to me, it's just a phase. And if you need someone to talk to, someone who will not judge you, someone who will give the 100% attention you need and offer soothing words of healing, you've got me. Together, we'll work the healing journey till you become the better version of yourself.
Beautiful, beautiful,
And
lovely.
to
Thank
everyone,
you so much.
sorry, please, everyone who will be listening, I tell people a lot this. I tell them that I'm rooting for you, I'm counting on you, and I believe in you.
Beautiful, beautiful. Thank you so much. Thank you, lovely. Thank you, Abigail. I have had a really wonderful experience, in this conversation about a topic that, again, is, generally quite difficult, but hopefully will be, useful to our audience and, all the people that are joining us in this conversation. And I look forward to having you back on again for us to look into
A
other
pleasure. I
areas
look
of
forward to it
mental
too.
health and wellness. Thank you. Thank you. Have a beautiful day.
Thank you. Thank you for having me on the show. I appreciate it. Thank you to all the listeners. Thank you. Thank you.
Bye.
All right. Bye for now.
Bye.